Welcome to today's press briefing. We have with us three speakers. They are from the CHP, Head of Communicable Disease Branch, Dr. Chang Shuk Kwan, from Hospital Authority Chief Manager, Dr. Lau Ka-hin, and from the Scientific Committee on Emerging and Zoonotic Diseases Chairman, Professor David Hui. You will hear from the three speakers update on cases, the situation in the HA, as well as vaccination. Good afternoon. First of all, I would like to give you information about the situation in the HA. We have 1,536 patients staying in hospitals, 171 new cases. Those in isolation facilities, 474 of them are in isolation facilities. 91 of them are in second-tier isolation facilities. 452 are in the North Lantau Hong Kong Infection Control Center. There are altogether 137 new cases. Yesterday, we have reported 3 critical cases and 5 serious cases. Of those who are staying in hospital, there are 16 cases of critical patients and 28 serious cases. 6 of the critical cases are in ICU. Yesterday, we mentioned about the 35-month-old boy. He left the ICU and was receiving treatment in isolation ward. The situation is stable without any fever or seizure. We continue to monitor his condition. We have another new report. 11 death cases, 4 males and 7 females, aged between 22 months and 96 years old. The 22-month case was the baby girl from Eastern Hospital. We have already given information on this case. For the other cases, the age ranges between 65 to 96. Of the death cases, 4 were from care homes. Only 2 have completed 3 doses of vaccination. That is, 9 have not completed the full course. We'll now look at the cases. The number of cases is on the increase, that is, in terms of death cases. First of all, is related to the number of increasing cases. With an increasing number of confirmed cases, there will be a percentage of them that would become serious conditions or critical conditions and in the end result in death cases. Vaccination can protect patients. Of the 11 death cases, 9 have not completed the 3 doses course of vaccination. As you know, that 3 doses, those who have not been vaccinated, the death risk is 15 times higher than those who have completed the 3 doses. So if you have not been vaccinated, please do so. If you have received 1 or 2 doses, please get the 3rd dose to boost the protection for yourself. Of the death cases, there is 1 case, 65-year-old male. He suffered from a late stage of lung cancer. The death cause is related to the lung cancer. It's just that upon admission, he was tested positive for COVID. For the other cases, for the other 9 death cases, the age range is 81 to 96 years old. 4 stay in elderly homes. They have all been vaccinated. We see more elderly people from the community that have contracted COVID. Most of them have not been vaccinated. How do we reduce the risk of a serious condition? First of all, is to reduce the chance of an infection. For young patients, they may not become serious cases, but if they transmit it to elderly people or those with chronic illnesses, the risk of the condition developing into a serious one is higher. And if you are fully vaccinated, the risk is lower. If you spot symptoms at an early stage, please seek medical attention and get prescription of oral medication for COVID. The rate of increase is high. About a month ago, at the early stage of July, every day we have 1 to 3. 2 weeks ago, it was about 10 cases. There was a drop, but the average daily was about 5 to 6. Today is 11 cases. COVID is not just influenza or cold, so please get vaccinated. And if need be, please take the antiviral medication as soon as possible. I now move on to those who have recovered. 150 have recovered, including 133 that have been discharged. 5 patients were tested positive upon admission. 11 patients in the same ward or staff members are classified as close contacts. We have 26,188 patients that have contracted COVID. 25,602 of them have resumed duties. Good afternoon. We have yesterday 3,889 local positive cases, including 1,430 PCR positive cases and 2,459 verified RAT positive cases. We have 234 imported cases, including 219 PCR positive cases and 15 RAT positive cases. Dr. Lau mentioned about 11 death cases. In the 5th wave, we have 9,307 death cases in the 5th wave. Of the 234 imported cases, 142 were picked up at the airport. 79 were picked up from quarantine hotels, and 13 cases have already left quarantine hotels. Of the 234 cases, they came from 47 places. 7 places have imported more than 10 cases, including India 30, UK 26, US 22, the Philippines 21, Singapore 18, Thailand and Malaysia 15 each. And for the remaining 40 cases, they've imported less than 10 cases. In care homes, we have 3 elderly homes and 1 care home for people with disabilities that have recorded cases. Certain people have to be quarantined. One is New Life Association 悅和居 is a care home for people with disabilities. 1 resident confirmed and 1 resident has to be quarantined. The other one is Ngã Yuan Block 11 is an elderly home. 1 resident is positive. 5 residents will have to be quarantined. And for Christian Family Service Center, yesterday there were 3 residents that were confirmed positive. 3 staff members were confirmed. We have asked 9 staff members to be quarantined. Today we have 1 more confirmed cases from the staff members who were under quarantine. 馮堯敬夫人護理安老院 1 resident confirmed, 3 residents and 5 staff members have to be quarantined. In relation to schools, today is Tuesday. there are 383 schools reporting 549 positive cases, including 443 students and 109 teaching staff members. Of the 549 cases, they come from 83 kindergartens and childcare centers, 180 primary schools, 112 secondary schools, and 8 special schools. In the past week, 199 schools have reported 2 or more cases. Today, we suggest 14 schools to suspend teaching for certain classes that will last for 1 week. TMHK alumni 張圈昌學校 Class 1A 4 students are positive. 天主教聖母聖心小學 Untitled Class 6A 3 students. 基督教崇真會安基幼兒學校 The lower class 2 students. True Light Kowloon City Class 3D is a kindergarten. 普亮曲 Number 1 張永慶 Secondary School in Wong Tai Sin Class 1E 4 students. Yun Institute 崇德紀念學校 Class 4E 3 students. 龍普道官立小學 Class 4D 3 students. TWGHS 方少幼兒園 in Wong Tai Sin K1 and K2 classes 3 students. And 聖公會日立小學 Class 6B 3 students. And also 聖公會蒙恩小學 in 屯門 Class 3A 3 students. Hong Kong U alumni primary school. School bus number 8, about 8 students took it. 4 are confirmed. So those who ride that school bus will have to stop from going to school for 1 week. 新界婦孺福利會基督教明恩小學 Entitled Class 2C 3 students. 聖公會主愛中學 Class 2D 16. 五邑周振物學校 in 屯門 Class 4C 3 students. And 2 schools have been asked to suspend classes. One is 建明幼兒學校. There was a prep class, 5 students, 5 pupils and 1 teaching staff have been confirmed. We asked them to suspend classes. There is another student that have been confirmed. There is also another one from the lower class with 2 more cases. For nursery, 1 pupil, 1 teacher. Lower class, 2 pupils. This is a small school, only 92 pupils and 17 staff members. 10 pupils and 2 teachers have been confirmed. So we suggest that the whole school will have to suspend classes. For St. Joseph's School, previously we've asked them to suspend class 4F for 1 week. For the same class, there are 3 students that have been confirmed. So we suggest that this class will suspend teaching.
Yesterday, the Joint Advisory Panel discussed the issue of vaccination for young children and adults. I'd like Professor Hui to elaborate. Thank you, the Joint Scientific Committee and the panel of advisors. I think we've made reference of information relating to children from up to 6 months. According to the clinical data, we found that there are 2 vaccines which can actually, generate the immunity, and there is also no safety concerns. Having looked at the local situation and the expected, peak in the winter season, the experts believe that it is suitable for young children to be vaccinated so that we can prevent the being infected and minimize the risk of death. For BioNTech, we've looked at some of the phase 2 and phase 3 data. 82 people, 6 to 3 months, 3 to 5 years, 143. for those who have taken 3 doses, the immunity is similar to those of adults, and the rate is 75% for 2 to 5 years old, 82.3%, which actually minimize the risk of infection by half. In Hong Kong, recently we found that for local data, those between 0 to 2 years old, after infection, the risk of death is 0.1%, 3 to 4%, 0.1% because they are not infected. 5 to 11 is 0.14%. Of course, for those between 12 to 17, they have been vaccinated. For this cluster, the rate is 0.01. So we hope that we'll be able to vaccinate the young children as soon as possible. For studies relating to the BioNTech vaccine, again, we don't see any risk of myocarditis or a series of diseases. Overseas, 4 countries have already recommended that we can lower the age threshold to 6 months for vaccination of the BioNTech vaccine, including Canada. And in South Africa, we also have some, stage 3 clinical data for those between 6 months and 35 months. So there you have the placebo group and the control group. Those who have taken 2 doses of the coronavirus, the immunity is quite satisfactory. For young children who have been infected, if they take the vaccine again, the immunity is even higher than those who have not been vaccinated. Again, there's not too much side effects. For those who have taken the coronavac, there are mild complications. It's 33%. For the placebo group, it's 27%. So the side effect is not very serious. For BioNTech, we recommend that there should be 3 doses. For the first 3, between the first and second doses, there should be an interval of for 8 weeks. For the third dose, it should be there should be a longer interval between the second and the third dose. For after 3 months, I think the third dose should be administered 2 months after the second dose. Also, at the meeting, the experts also discussed the data relating to adults. While the high-risk group are those over the age of 60, but looking at the age group of 50 to 59, if they are not vaccinated, the death rate is 0.86%. If they have 1 dose, 0.17, 2 doses, 0.26, 3 doses, 0.01%. Most of the people in this group had taken 3 jabs. The T cell, while it dropped a little bit after 6 months, for those aged between 50 and 59, we recommend that they should take the 4th, doses so that we can minimize the risk of serious complications. I think both vaccines could be administered. 3 doses of BioNTech or 3 doses of the coronavirus can prevent serious infection and death cases. It's almost 98%. So these are the issues we discussed yesterday. It is now question time. Before you put your question, please tell us the organization you represent. I'm from Now TV. First of all, we note that only young children only be administered with the coronavac vaccine. For BioNTech, are you going to procure the vaccine, the formulation for young children or for adults? Some experts will say that there are difficulties with dilution, and there are some precedents here. How are you going to resolve this problem? I understand that some young babies they need to take other vaccines. For such vaccines, compared with the coronavac, COVID vaccine, would there be any conflict, and should there be any interval between the administration of such vaccines?
We're aware of the recommendations of the scientific committee. We have spoken to experts. It seems that dilution is not viable. because there are many difficulties. The government is in discussion with relevant pharmaceutical companies for a specific dosage for children. Yesterday, we had a discussion about other vaccinations in tandem. The recommendation is that can be done in tandem. Next question, the one on the left, last but one row. I'm from cable TV. First of all, the government may be talking to Sinovac about children's dosage. Well, what is the estimated amount? Will the supply be sufficient? And what about the discussion with BioNTech? If you fail to procure vaccination, how long will you wait before you allow them to take BioNTech? And when will you allow young children to be vaccinated? In relation to the Mirror concert, there was another dancer who was injured, Cheung. He was discharged on the 29th of July, but today we heard that he actually hasn't been discharged. What was his injury when he was discharged? And it was said that he was transferred to a hospital of the TMHK. Why? For Sinovac, they use the same vaccine. There is no children's version, so we already have supply. In relation to vaccination, starting from this Thursday, that is the 4th of August, children can receive the CoronaVac vaccination. You can refer to the press release for details. In relation to Comirnaty, the government is talking to the pharmaceutical company. We don't have any update yet. I think you're talking about the two injured person from the Hong Kong Coliseum. One is still in the ICU receiving treatment. The other injured person, on the 29th of July in the afternoon, that is last Friday, after signing relevant documents and accompanied by family members, he discharged himself. Before that, the medical team has already provided medical check and treatment to the injured. And there was also a clinical assessment done, and treatment proposals suggested. Upon discharge, the injured person was in a stable condition. If the patient wants to discharge himself, our medical team will explain to the patient relevant risks involved. We will also make recommendations on treatment. The patient has the right to decide whether to discharge themselves, to go to a different facility, or stay in the same hospital to receive treatment. The hospital will try to accommodate as far as possible. Sorry, speakers off mic. The interpreter cannot hear. Thursday. Next question. The one on the left, the gentleman at the back. I'm from AM 730. The recommendation was that for 6 months to 4 months, 3 doses, 5 to 17, 2 doses. The dosage may be different. How come that for those who are older, only 2 doses, whereas younger ones are 3 doses? Something to do with the dosage? You talk about difficulties in the dilution. Is this something to do with the equipment or the difficulties to get the exact dosage? What is the impact? Do you think that it would be easy to buy from pharmaceutical companies the children's version? I have already answered that question. I'm talking about those. I'm talking about 3 milligrams. For older ones, 10 milligrams. We have asked experts. Currently, it is not feasible. I'm not an expert in this field, so I cannot answer you. The government is in discussion with pharmaceutical companies about suitable vaccines for children. That includes Comirnaty. I'm from Mingpao. First, a question for Professor Hui. Those under the age of 3, 2 vaccines are there common side effects or serious side effects? You mentioned about Comirnaty. You don't see any data relating to myocarditis. So there is no risk or a very low risk. Previously, for teenagers, in Hong Kong, the figures is worse than the figures in relation to myocarditis compared to overseas. If you don't have data in relation to serious condition or fatalities, that means parents don't have the information to make an informed decision. You talk about vaccination done in tandem. Do you mean at the same time? By the end of the year, what is the desired vaccination rate for young children? You talk about 基督教香港信義會. Does it mean that there is an outbreak inside the school? Is it the first time the whole school has to be suspended? We see number of cases reaching over 4,000. It seems that there are more classes being suspended, but students mostly would have been vaccinated. Is the epidemic situation worse? For Comirnaty, its side effects after the vaccination, usually it's pain at the vaccination site, lethargy, drowsiness, and fever. We don't have any risk. We don't see any data in relation to myocarditis or death. For coronavac, it's just localized side effects. That is pain at the vaccination site, low fever, some coughing. A small number of people said that they vomited and suffered from diarrhea. So most of them complain about the pain at the vaccination site. For Comirnaty, we're also concerned about myocarditis risk. That's why we suggest that the vaccination should be done on the thigh to reduce the risk. For coronavac, we don't have information about antibodies. Well, if you see that there is the presence of antibody and there isn't much side effect, you wouldn't wait for further information. Well, on the same day, children can receive vaccination of different types, but at different location. For the Sun Yi Hui, for the TMHK Kinming Nursery School, it's a very small school, and they are very young children. There was nap time, and currently there are 10 pupils and 2 teachers that have been confirmed. We're concerned that perhaps inside the school there is a transmission chain. That's why we suggest the school should be school operations should suspend for 1 week. At the moment, the figures are quite high. We see an increasing trend. The pattern of schools follow that in the community, so it is on the increase as well. There are about 3 or 4 cases in the classes where there is a suspension, so it's not too serious. For the nursery school, it's the first one that we have asked them to suspend classes for 1 week.
I think we don't have that for the moment. After the launch, we hope that they can help prevent serious cases and death cases. I hope parents will take the children for the vaccination.
Would you recap in English, would the authorities consider diluting the adult dosage of BioNTech or procure an infant dosage from the pharmaceutical company? And if the government decided to go for the latter, what's the earliest date for BioNTech vaccines to be available for children? And would the government change their mind if it couldn't be made available shortly? And the second question, would the scientific committee recommend mixing the vaccine when BioNTech is available for better protection? And the third question, was there any discussion within the authorities to put young children under vaccine pass requirement to encourage vaccination? Thank you.
I understand from the experts that diluting the adult dose of BioNTech to provide vaccination for the younger age group under 3 is technically there are some difficulties, and so the government is trying to liaising with the pharmaceutical company to discuss about the purchasing of the pediatric formulation.
Your question on mixing of vaccines. Well, there is really lack of data for this young population. So at this stage, we don't recommend mixing vaccines. I think it would be a good idea to use the vaccine pass to drive up the vaccination rates in all age groups.
下一位，我哋答埋最後一位，右手邊最後嗰行嗰位先。
Some questions from RTHK. So, the government lowered the age limit for the Sinovac vaccines. So, under what conditions can the age limit of BioNTech vaccine be lowered as well? And is it worrying for young children to have side effects after vaccination? And as Dr. Lau mentioned, there's been an increasing number of deaths. So, what are the reasons behind, and is this a worrying situation? Thank you.
I will reply the number of deaths. Yeah, I think the proportion is still very low, and the case fatality rate is still maintained at very low level. And with the vaccinated and non-vaccinated, there's a big gap between them. So, but because of the recent increase in number of cases in the community, and we did observe an increasing actual number of daily fatal cases. So, but the proportion is still very low. And
dosage. Okay.
Dosage.
Well, young children and adults basically use the same dose for Sinovac. Okay, so because the dosage is already available, so they can start the program. As for BioNTech, I think it really depends on whether we can get hold of the 3 microgram specific formulation. If we can get hold of the formulation, we certainly will start as soon as possible. As for the side effects for BioNTech, based on the phase 2 and phase 3 clinical trial, the major side effects are actually local side effects, such as injection site pain or tenderness, fatigue, irritability, and some drowsiness, fever, etc. In the phase 2 and phase 3 clinical trials, there were no case of myocarditis, vaccine-associated anaphylaxis, or death reported in any of the trial participants. For CoronaVac, based on the information we got, the side effects are also mainly local. So the injection site pain, some with fever, cough, some with diarrhea and vomiting. There are no major side effects also.
I would also like to supplement the figures about the case fatality. So the overall case fatality now is still 0.7%, with if it's unvaccinated, the case fatality rate is around 2.9, and vaccinated with 3 doses is lower to 0.04%. For those who are aged 80 years and above, the case fatality rate for those unvaccinated is 60%, and for vaccinated with 3 doses is 1%. So it's around 50 to 16 fold.
今日記者會完結，多謝大家。
That's the end of the briefing. Thank you very much.
There are increasing number of deaths when comparing the figures in the early July. In the early July, there's only a few cases per day, 1 to 2 or 2 to 3. But in the recent 1 week, we know that there is average 5 to 6 deaths per day. Even last Tuesday, there are 10. Today, we have 11. So what is this means? This means there is an increasing number of infections in the community. So there will be an increasing proportion of patients being suffering from critical or serious conditions. Some of them may die, unfortunately. So how can we do it to reduce the infection? For example, enhancing the infection control measures, wearing masks, reducing the activities without mask is one of the important measures. We know that we understood that the death cases are mainly in the elderly, in the chronic illness patients, as well as in those without vaccinations, especially without full vaccination, we mean 3 injections. So we want to appeal to the public that please go to the vaccination as soon as possible. If you haven't have one, or you have 1 or 2, please do the 3rd one. At the same time, if you have an early disease with mild symptoms, please go to see the doctors as soon as possible. Because if you are an elderly or you have a chronic illness, you will be given oral antivirals, which can reduce the chance of becoming serious or critical cases, as well as reduce the death. Thank you.
多謝大家。
Thank you very much.